Thanks for joining us on Campus Connect. This is Robin Proto. This afternoon, we're going to be talking about vaccinations, a hotly discussed subject that's been a prominent news story throughout much of 2019. Earlier this year, the state of New York eliminated the religious exemption to vaccine requirements for school children, that in response to the nation's worst measles outbreak in decades, 90% of which were reported in New York State. The new law gives unvaccinated students up to 30 days after they enter a school to show that they've had the first dose of each required immunization. Medical exemptions are allowed when a child has a medical condition that prevents them from receiving a vaccine, but all non-medical exceptions have been ended. Last year, that amounted to about 25,000 children in the state that claimed the religious exemption. The issue is still talked about passionately, and earlier this week, Supreme Court Justice upheld the vaccination law. Today, we're happy to have a special guest here in the studio to talk more about this. We have Dr. Sharon Nachman, Chief of the Division of Pediatric Infectious Diseases at Stony Brook Children's Hospital, and the recognized international leader in the area of pediatric infectious diseases and the treatment of children with AIDS, flu, and measles. She's been the principal investigator of more than 30 clinical trials of promising medicines for patients treated at Stony Brook University Hospital. These include international trials in areas such as new vaccines, Lyme disease, and AIDS. So without further ado, let me welcome Dr. Nachman.
Thank you for inviting me here today.
It's great to have you here. And why don't we start by you telling us a little bit about yourself and what you do at Stony Brook, and maybe give us a background on the training you've had.
Thank you. So I'm a product of New York schools. I went to City University of New York, and then I went to Stony Brook for my MD. I did a residency at Cone Children's, a fellowship in pediatric infectious disease at Lincoln Hospital in the South Bronx, and then a postdoc at Rockefeller. So I've been here my entire medical training, academic career, and I've been at Stony Brook for over 25 years.
How many of those years have you been dedicating to vaccines?
So I've been at Stony Brook for all those years, and as part of my requirements for work, have been interested in making sure that children get the best medical care for infectious disease, including vaccinations, the entire time.
Okay, I guess we'll start there. Can you tell us a little bit about this new vaccine law the state has passed and the impact it's going to have on local school districts as we've got schools starting up next week? What should families, do to prepare as the school year starts?
So like any other prep for school year, you want to make sure that your child is healthy and well when they're going into school. They're going to be seeing lots of other children from lots of other places, and we want to make sure that your child, just like any other child in school, doesn't get sick. That includes making sure they're up to date on their vaccinations. As you know, in pediatrics, we are very much into preventive medicine. We don't want to treat the pneumonias, we want to prevent the pneumonias. We don't want to treat measles, we want to prevent it. The new law that was just enacted recommended that every child receive the age-appropriate vaccines that they should be getting unless they have a specific medical exemption not to get those vaccines. So you have to get the first dose that you need before school starts, or right now, and then certainly get the next few doses that are age-appropriate in the next upcoming months. This is important not only for your child, because we don't want your child to get sick, but because of community protection. We want to make sure that your child, if they did get sick, would not be passing infections that are preventable to other children. As you know, measles has no treatment. That means the kids who get exposed to the virus are going to come down with infections. Measles is highly, highly contagious. And we saw that in New York City as well as in other states around the country. A child with measles went to California to Disney, infected over 300 people. An adult who went to Detroit with measles infected over 30. Measles is highly contagious. So by not having a child vaccinated, they're going to be at extreme risk for getting the disease. Measles is so infectious that if your child had measles, went into a room and coughed a couple of times and left, and someone else's child went into the same room, think of it as a bathroom or any kind of public space, and they themselves were not vaccinated, they would get the disease, even if it was 2 hours later after the first child went into that room. You never saw that first child. You didn't know they had measles, but your kid now comes down with this infection. So infections that are preventable should be prevented. The other problem with measles is that one of about 500 to 1 to 1,000 of those children who get measles will have the potential to have an acute brain problem when they're in their teens and early 20s. It's the hidden surprise to the infection. They'll have measles, they'll get well from their measles, and then 10 to 15 years later, they'll suddenly decompensate, do poorly, and unfortunately die. We want to prevent that from happening.
Two of the points I've heard, there's not a lot, but there is some resistance to the vaccination law. And two of the points that have been brought up are that there's an element of risk associated with the vaccine, especially with autism, and regarding preservatives or chemicals that may be in the vaccine. And the second point is that vaccinated children can't be infected by children who are not vaccinated. So that the claim is that the risk is being overplayed in the media. Could you talk a little about those 2 points?
Certainly. Let's take the first one. What's the risk of vaccinations? Is there something scary in the vaccine that will cause a problem? With regard to the autism debate, as you know, the investigator that started that has actually had his medical license revoked because the data that he used to talk about that was actually misrepresented and was never repeated and has been completely debunked. So people are right to worry about what's in a vaccine, but worrying that a vaccine can cause autism has actually no basis in fact. The second concern about what are those preservatives in vaccine is an easy answer, and I tell parents, well, preservatives are meant for something that's going to have multiple uses. In pediatrics, every vaccine is a single use. We take it out of the refrigerator, and we give it to the child, and we throw it away. That means single use equals no preservatives. There hasn't been any thimerosal or any mercury-containing substance in any pediatric vaccine since before 2000. So any pediatric vaccine given anywhere in the U.S. to a child is a single-dose unit, no preservative, has no mercury, and therefore is not a concern with regard to autism or anything else. With regard to your second or third question about if a child got 2 doses of measles, they shouldn't worry, and the answer to that, unfortunately, is not true. New York City did an outstanding job looking at all the cases of measles in the spring, and what they saw, unfortunately, was that not only did some of the children who had gotten 2 doses of measles vaccine still get the disease, but older patients or elderly patients that probably had doses of vaccine in the distant past also got measles. And as you know, the older you are with an infection, the worse you do.
So the risk has generally been portrayed as an in-school risk, but the risk is actually a danger to the greater community at large.
Right, and that's why we talk about community protection, because we know that if you protect children, you protect their parents and their grandparents.
Okay. Another criticism I've heard of the law is the influence pharmaceutical companies have over the politicians that are enacting these laws. Have you found any conflicts in your research regarding influence of pharmaceutical companies?
With regard to my personal work, the answer is no. I am funded by NIH. I have no conflicts of interest. I don't get any money from any pharma company for any of the work that I do. But more importantly, internationally, measles is a huge problem for us. And as you can imagine, pharmaceutical companies give away measles vaccine almost for free. It's paid for by the World Bank and WHO, so there's no conflict of interest with supporting measles vaccination in the developing world. We do it, it's for free, and no one gets any money.
Do you expect more measles to be coming up in this next school year, or has the efforts done to curtail the problem of last year been enough?
I think the efforts will help us tremendously. I think having this new law requiring children to get all of their vaccines will definitely help cut down on the measles. But as you know, New York is a hotbed of airports. We've got lots of airports around. A lot of our children and families fly places, and their relatives from other places fly here. We are seeing measles epidemics all across Europe, as well as in the developing world. So just because our kids are vaccinated, and maybe the elder and older parents in the household got vaccines years ago, doesn't mean they're not going to see somebody who's bringing measles into the country.
How do you get the parents you deal with motivated and educated to what you've just told us this afternoon? What advice do you give to them to move forward to protect their child as best they can?
I think the first question is having a frank discussion with your pediatrician. What is it that you're worried about the vaccine? Listen to the answers as opposed to just saying no to all vaccines. Not all vaccines are created equal. Some vaccines are live viruses, some are not viruses, and some are just particles. They're not all the same. Understanding what each vaccine protects you from, why it's given at a certain age, is really important. Certainly by the time a child is in school, we know who has any underlying medical issues. And that's the time we want to make sure the rest of the class is also protected. So making sure, just like the New York State law says, that children who are coming to school are protected is really important for all the kids and the teachers and the parents of all those kids in school.
Okay, having mentioned that you do expect to see more cases of measles coming up, what should a parent who suspects their child of being infected do to avoid infecting even a larger number of people?
Well, I guess the first answer is don't panic. The second answer is prepare to call the pediatrician and say, I think my child was exposed, or I think my child has the measles, and take advice from them. Don't run to the pediatrician's office, or worse, don't run to the emergency room or an urgent care center, because if your child truly has measles, they will expose a huge group of patients who are already sick. So we want you to say, call the pediatrician and follow their advice. They may tell you things like take a picture and send it to them. Or they may say put a mask on to the child and come after hours. Certainly coming in the middle of a busy workday to a pediatrician's office or an emergency room is going to be a problem. If those children are truly sick, it is measles, and they have measles pneumonia or measles encephalitis, they do need to be seen, but we want to see them in the right place at the right time.
Is there anywhere parents can go to find more information about the vaccine issue?
Sure. One of the best resources for parents, it's free and they can easily go through it, and it's in Spanish as well as English, is the CDC website. As you know, CDC is conflict-free, so they can't get any money from any pharma company for anything on their website or any opinions that they may have. The website is www.cdc.gov, and it's readable, it's understandable, it's in several languages, and it's a great resource for parents, not only about measles and measles vaccine, but other infections that our children get.
Once again, that website was www.cdc.gov. We've been talking to Dr. Sharon Nachman. She's Chief of the Division of Pediatric Infectious Diseases at Stony Brook Children's Hospital. And thank you for joining us and illuminating us on this hotly contested issue right now as we're heading into the school year. Appreciate it.
Thank you very much.